Good morning, good evening. Welcome to the Voices of Sustainability virtual fireside chat series. I'm Julia Piper. I have the honor of being on the selection committee for the Zayed Sustainability Prize's energy category. I'm delighted to be joining you all today, though, to talk about health, something I'm actually very excited to learn more about and speak with some excellent applicants and awardees of the prize today. I'm also Vice President of Public Affairs at GoodLeap, which is a company based in the United States that helps finance clean energy solutions here in the US, and we develop clean energy projects around the world through our nonprofit Give Power. So the Zayed Sustainability Prize was established in 2008 as the United Arab Emirates Pioneering Global Award for recognizing organizations and high schools for the sustainable, innovative, and humanitarian solutions. Today, the prize counts 16 years of global impact with over 384 million people around the world benefiting from its winners' solutions across the categories of health, food, energy, water, and climate action, as well as global high schools. In today's episode, we'll focus on how artificial intelligence, AI, is revolutionizing healthcare, especially in underserved communities. So first, I'd like to introduce our speakers. We have with us today Amr Abodraiaa, Rology co-founder and CEO. We have Veena Moktali, Periwinkle Technologies co-founder and CEO, and Camila de Pamphilis, Mammotest, Head of Global Business Affairs. Welcome to each of you. Great. Well, we're going to jump right in. Thank you. Excellent. Let's jump right in. So, Amr, I'm going to go to you first. So there's lots we could unpack here with the intersection of artificial intelligence and healthcare, and we're going to get to a lot of that. But I'd love to go right into the heart of the material here. How is Rology's AI-driven teleradiology platform, you'll have to tell us what that is, improving access to diagnostic services, and what advancements do you foresee in enhancing diagnostic accuracy for various health conditions through AI? So tell us a bit about Rology's AI-driven teleradiology and kind of fit that into the AI technology revolution we're seeing today.
Yeah, thank you, Julia, for the question, and thank you, the advice, for the opportunity overall. Actually, before jumping into Rology, we need to think about actually how we can classify or categorize the health overall. So we have the preventive health, and then we have the diagnostic health, and then we have the treatment health. Most of us, when we think about healthcare overall, they think about the treatment health mainly, but they don't think a lot when it comes to preventive and diagnosis also as well. So, and actually, when we think about the AI and how AI can impact healthcare, we need also to think about the three main categories and how we can fit the AI specifically in each category overall. In Rology, we are focusing on diagnostic health. So when it comes to diagnosis, and under the diagnosis, you can see lab tests, clinical pathology, and so on and so forth. And we have also the other pillar, which is when it comes to radiology overall. So teleradiology basically is about deliver the final diagnostic report in a remote way. So think about having a radiologist to diagnose your scan as a patient, and but he's already working from home. Or something like this. So this is the main concept when it comes to teleradiology. The main idea we did as Rology that we build a zero setup cost platform. Teleradiology has been there for a while, but we built our own technology to be a zero setup cost. So there is zero requirements when it comes to the hospital side. They don't need to have something like PAC system, huge infrastructure, VPNs. They don't need any kind of this. So we can say that in Rology we trying to democratize the teleradiology concept as much as we can. But where is the AI? Actually, the AI is coming when it comes to how we can support the radiologist to do his work in a faster and more accurate way. So overall, the main problem, which is we are trying to solve in teleradiology and radiology and all of this, and in all this spectrum, is about the severe shortage of and the misutilization of radiologists. So there is no enough radiologists all over the globe to diagnose all the scans which is already happening there. So this is actually where the AI mandate can help and can come, which is helping the radiologists we already have to do more work and to diagnose more scans and to help more patients to get diagnosis in a very fast way. So what we have in Rology, we have three main categories when it comes to AI. The first one, which is matchmaking AI algorithms to help the platform to select the optimum radiologist to work on a specific scan based on the type of scan, the request type, and the medical history of the patient, and all of this stuff. So this is the first one, which is actually this type of AI, this category of AI can help hospitals and healthcare providers in the high fragile context to use the AI actually, because there is no setup cost, there is no infrastructure needed, and so on and so forth. The second category, which is an assisted tools to help us as a platform to manage the accuracy. So how we can review the medical accuracy for the patient and actually for the radiologist as well to deliver a high accurate report overall, which is something we called probability of review. The third category, and this is the most famous category, it's about diagnosis itself. So we have an AI algorithms to provide a primary or preliminary report for this specific patients. And then we have the radiologists who started to finalize this diagnosis and this report to be delivered to the patient. So when we think about radiology, we think about the combination between the teleradiology and the AI to, by the end of the day, give the empowerment to the healthcare providers in the underserved communities and in the high fragile context also as well, to use both, to use the AI without any kind of hassle about integrations, embed this kind of AI into the workflow and so on and so forth. So using urology as a single point of integration with a zero setup cost to have this kind of package between the AI and also the radiologist.
Wow. Okay, a lot to unpack there. Can you tell me just a little bit more for scene setting? Where are you operating today? Is this in the field? Is this something that's helping patients today?
Yeah, actually, we are focusing in MEA region, Middle East and Africa. And our home market has been Egypt. So this is where we started in Egypt, Cairo. And right now we are serving more than 100 hospitals in Egypt, rural areas, and so on and so forth. And then our second office is in Kenya, Nairobi, which is our East Africa office, and we are working with more than 70 hospitals and the community healthcare providers in Kenya, Tanzania, Zimbabwe, and Zambia also as well, Malawi. In East Africa in total, and our third office is in Saudi Arabia to provide also the teleradiology services in Saudi Arabia overall. So in total, we managed to help more than 1 million patients to get their final diagnostic report in time with a high accuracy, and through working with more than 200 healthcare providers around 9 countries in Middle East.
Wow. It's making the artificial intelligence opportunity really real, it sounds like, in such a tangible way, not just for interesting images and chat bots and things of that nature. It really brings it home. Yeah,
it's already
Veena,
there.
I'd like to go to, great. Veena, I'd like to go to you next. So as cervical cancer is highly preventable, I understand, and it's curable with early detection. How does SmartScope CX improve detection, the technology that you're providing? How does, and also how does AI enhance its effectiveness compared to, say, traditional methods? Can you walk us through that?
Sure, Julia. Thank you so much for that question. Excellent one. So just to give a background on the traditional methods, all of us may have heard about a test called the pap smear, which women above the certain age groups, such as 25 years or 30 years, depending on the country, are advised to go through, right? So there are lab-based methods like the HPV DNA or pap smear, which typically take some turnaround time to get the report. So it could be anywhere between 2 days to 15 days, depending on how much infrastructure and experts you have available in a particular region. So that's point number one. Point number two is because of the dependence on these experts, these programs are often not scalable, and also they tend to be a bit costly. And third most important aspect is after you perform these lab-based tests, if a patient is identified as suspect positive, that's the terminology we use, in that case, you need to repeat a visual test such as colposcopy again for that patient. So that adds more to the cost. And because of all this multi-visit protocol and because of the costs involved, and also importantly, because there are no symptoms visible in the early days of cervical cancer, women often don't go back to collect their reports back. So therefore, there's a loss to follow up. So with the SmartScope AI, we provide the result with a visual examination within 30 seconds in the same visit. So the patient gets to know what the result is using the simple color code that we have provided. Patient can be counseled for the next step very easily by the healthcare worker. And because the device is also very easy to use and the AI color code is easy to explain, even healthcare workers with some amount of minimal training can use it in communities. So this kind of testing is now no longer limited only to urban settings. So it can penetrate to the remote corners of every region, even to rural areas. And it will reduce the turnaround time from screening to treatment because we have also enabled remote triaging in the same system. More importantly, because the device itself has a nozzle-like shape, which, I mean, it's a very specialized form factor, it is very easy to maintain and it provides uniform illumination of this object, the cervix, and therefore the AI that is developed based on that is also very reliable. So the accuracy of the test is also much better as compared to the lab-based tests, and also it is not subjective. That's
interesting.
Yeah, in a nutshell.
Yeah, I wonder if you could also, as a quick follow-up, frame the issue. I mean, what are the percentages of women who get diagnosed with cervical cancer each year? Do you have a sort of sense of the scope of the challenge we're able to tackle here?
Absolutely. So with today's methods, unfortunately, the numbers that get screened world around are anywhere between 2% to say maximum 10%. I mean, the maximum number I have heard is 10%. And I'm talking about countries that are still developing or low resource countries. There may be developed countries who have a significant coverage because they have the available resources. But at the same time, most of the world, most of the countries that are still not there are not able to screen their populations. The WHO, in fact, wants 70% of all the eligible women to be screened by the year 2030. And here we are talking about numbers such as 2% and 5%, which is very, very low. But this is just about the coverage. About the percentage of women who are identified as positive, I would say that if, let's say, the amount of screening were as desired, then somewhere between 4 to 5% women would be identified as those who have high-grade lesions, or as we call them, high-grade precancer. About 8% women to 8 to 10% women would be in the low-grade lesion. So these can be simply followed up. They don't need any aggressive treatments. And then there could be perhaps anywhere between 20 to 30% of women who are simply presenting benign conditions such as reproductive tract infections. So they could be treated symptomatically, though, I mean, they don't even need any expensive treatments. So the best part is all these women that I spoke about are still at a stage where they can be treated with minimal outpatient level treatments, and they don't require any inpatient admissions. And even the expense for those treatments is quite less.
Wow. Really saving, I'm sure that amounts to millions and millions of lives at the end of the day, if not billions. That's
Absolutely.
Fantastic.
Yeah.
Okay, great. Camila, turning to you now. So tell us about Mammotest. How is it using AI to improve breast cancer diagnostics in underserved communities? I understand you're all across Latin and South America. How does this technology ensure more women have access to life-saving screenings? Since winning the prize, the Zayed Sustainability Prize in Health, what are your plans for expanding AI as well to reach even more women? So excited to hear from you.
Thank you very much, Julia. So just as a little background, breast cancer is the #1 cancer worldwide, affecting 1 of every 8 women. And with a 98% survival rate if detected early, still 7,000 women die every year of it. 60% of these deaths actually happen in developing economies, as 80% of them are detected at a late stage with very low chances of survival. So what we do at Mammotest is we approach breast cancer in an holistic way, using technology and AI to improve accuracy, efficiency, and accessibility. Specifically talking about our application of technology and AI to contribute to approach all women. We do it at actually every stage of the patient journey by providing this holistic solution. So increasing awareness and accessing to screening particularly in underserved economies such as Latin America, is only the starting point or the initial trigger, I'll say, to generate an impact on the reduction of these mortality rates created by breast cancer. Because our approach includes guaranteeing timely access to treatment, reducing costs, and increasing quality of life outcomes for patients. So what we provide is an enhanced diagnostic precision and faster turnaround for results by integrating computer vision, AI algorithms to support the radiologist's decision-making and prioritize their work lists. This, as Amr very well mentioned, is key to help reduce the impact of this global shortage of radiologists. We provided teleradiology and remote access. Our platforms allows radiologists to review images remotely from anywhere. So this model somehow overcomes geographic barriers, connecting specialists in urban or big cities with patients in maybe rural or underserved areas, significantly widening the access now. We also and mostly provide patient navigation and follow-up services. So our platform includes a digital navigation to guide patients throughout their diagnosis, treatment, and follow-up, ensuring that more women complete their necessary steps for effective care, improving outcomes across communities where healthcare pathways are affected or disruptive because of a fragmented system. And we not only consider the clinical profile, but also their socioeconomic and psychological status to provide personal guidance. So if during the screening a patient is identified as a risk patient, what we do is we automatically, using technology, provide our digital navigation services so as to guarantee that the patient doesn't have to overgo alone any informative, economic, or psychological barrier to go through their patient journey. So by this, we are generating somehow an affordable and scalable model that is not only limited to women in big cities or with high economic status, but democratizing to all of them. Also regarding our plans for AI-powered diagnostics development, our idea is to continue focusing on two main areas, which is enhancing our machine learning model to develop and refine our algorithms and support radiologists in the imaging interpretation, not only for breast cancer, but also for other pathologies such as lungs, cervical, colorectal, and even prostate cancer. So by optimizing the workflows, we aim to prioritize high-risk studies, reduce burnout among healthcare providers, and identify malignant findings that may not be detectable today by the human eye. And also improving our virtual navigation assistants We plan to deepen this development of navigation to enhance its automation, usability, and applicability to other pathologies too. And this will help us lower the operational costs, providing personalized support to patients and ensuring they receive the necessary guidance throughout the healthcare journey.
So this is super exciting. Both you and Amr talked about how, I guess, the AI is a co-pilot, a sort of assistant to the radiologists. But I'm curious, to what extent is that community embracing artificial intelligence? And maybe this goes for patients too. So Camila, just to add on a little bit more, because you went so in depth on the technology side, if I hear that as a patient, like, what does that word mean? Additional screenings, networking, machine learning. Am I going to get good care? So I'm just curious, from the perspective of the patient and maybe the radiologists you work with and doctors, are they embracing of the AI? Or is there some education and learning there too needs to be done?
Yeah, I'll take it, Amr, first, and then you can you can compliment maybe. I think that still some educational and cultural barriers affect the implementation or the adoption of these technologies. We at Mammotest today offer it as a back-end support solution. That's something that maybe radiologists or healthcare institutions see as valuable, but not the patients. The patients still keep the figure or the image of the doctor as a final word, which we also support. But it's a little sensitive to see that somehow your healthcare is relying only on technology. So on our communicational strategy, we use AI for the medical or the doctor's side, but still for patients, we just rely on the results. We give them quicker, the faster turnaround results. We guarantee the quality and affordability because of the cost reduction. But AI is still not valued as something extra.
Yeah, and
it's early days, I will say. Yeah.
Actually, it's not about early days. It's actually about this is how it can work when it comes to diagnosis, and most probably it will be almost the same when it comes, because we need to think about from a medical perspective, not just from an AI perspective. From a medical perspective, diagnosis is a D2D, doctor to doctor specialty. So the diagnostic doctor, whatever he is, a clinical pathologist or a radiologist or something like this, his main rule is to support the treatment physician, which is the one who deal with the patient overall. So when we think about AI in diagnostic, we think about a co-pilot for the radiologist, this is one, but also in other scenarios, we can generate a full report through the AI and the full diagnosis through the AI to support also the treatment physician in general. But when we think about the patient, we think about the AI solutions for the patient. We need to move a little bit to another medical or medicine category, which is the preventive medicine, as an example. So when we think about to educate the patient, we can. There's a lot of solutions to use AI to educate the patient, and this is a patient. A patient-centric and patient communication tools overall when it comes to guide the patient through how to navigate himself, the patient, him or herself, into the healthcare system. We can use also a different AI models in this, and this can actually interact and engage with the patient overall. So it's mainly about the medical process and how we can automate this through the AI. So as an example, preventive medicine, it's mainly about public health, patient communications, and the patient educations, and so on and so forth. And we can use a lot of AI in this regard. When it comes to diagnosis, it's mainly D2D, doctor to doctor. So it mainly when it comes to how we can support the so I don't think it's about the early days, but it's mainly when it comes to the medical mandate when it comes to every single specialty or category.
Let's see. Well, to sort of turn the corner here, we're going to turn to our lightning round. I know there's lots we could continue to unpack here, but we'll try to move to sort of some faster questions, go around the table, so to speak. So Veena, I'd like to start with you. So a little bit shorter answer here, and I know it's a big question. What would you say are the most critical barriers preventing widespread use of AI-driven healthcare solutions in low-resource settings? So what are those critical barriers today?
Some of the points were, of course, covered by Amr and Camilla earlier, but one of the things is, of course, the awareness of the disease burden amongst the patients is one of the important aspects for any delivery of solution. Second is the slower adoption of technology by healthcare providers themselves, because although we were talking about acceptance by patients in the earlier question, acceptance by healthcare providers themselves or the doctors themselves is another big barrier. A lack of capability by the innovators to do outreach activities could be one more. Infrastructural requirements for delivery of some of the solutions could be a barrier. And of course, the biggest one is the cost of validation. While you're developing the solution, you need to not only clinically validate it, but also operationally validate the solution for larger impact. So those are some of the critical barriers.
Camilla, how about you for the next one? How can partnerships between industries such as technology, healthcare, government, help drive forward the AI innovations that we've heard about today? So how can those partnerships help come together to provide better healthcare?
That's actually a great question. I think that partnerships between these stakeholders are critical for driving impactful AI innovation in healthcare. Each sector offers distinct strengths. For example, tech companies lead in developing advanced AI tools, building and refining these models. Healthcare providers bring essential clinical expertise to ensure that these tools are effective and relevant. They guide and test them in real-world scenarios in the end. And governments create the regulatory and funding framework needed to make this solution scalable and accessible. Actually, I'll take the previous question regarding the barriers, and I think that bureaucracy is one of the most critical nowadays. I understand the ethical and bioethical sensitivity, but it's still in a field to be developed. And I think that together we can address healthcare challenges in a very holistic way. These collaborations might also enhance trust and transparency that are crucial for AI adoption. And working together will not only bring us innovative and effective solutions, but also help be compliant with regulations and access communities that need the most, rural, underserved.
Sounds like as you work on your technology, you will all probably have a lot of role in just educating as well. Conversations like this to bring everyone along and sort of demystify what is this AI in healthcare movement. So it's interesting. You got that stakeholder building as you got the technology development on the other end of it. We're going to you next. What key AI advancements would you expect or hope to see in the next 5 years to substantially improve global health outcomes? What AI advancements would you like to see?
So yeah, it's a very tough question because I think we have.
We don't know what we don't know yet.
Yeah, so we have. Yeah,
tell us the future, Amr, please.
Yeah. So actually, yeah, the future is evolving literally every couple of months right now. So yeah, and when it comes to the era of generative AI and how it can actually also impact how we think about our products, our future, how we build our backlog, and so on and so forth. It's evolving and need a lot of agility and need a lot of flexibility also as well from a to absorb and try to digest this technology and try to build based on that. But in general, I think technology is approving for us right now the ability of making everything democratized. So I think technology right now is democratizing energy, democratizing financials, democratizing everything. And this is actually what I really believe that what technology is doing right now when it comes to healthcare is democratize healthcare for everyone. So right now, literally, you can you can deliver the same um, medical accuracy, the same medical standard, if you can say, the same medical standard for someone in a very developed city, and also for to deliver the same standard when it comes to someone in a very rural areas and so on and so forth. So I think when it comes to thinking about the future, we think about a technology democratizing the healthcare and redistributing the power of and the power and the authorities in healthcare system into the right positions overall. So we might see and diagnostic services coming from the mobile cell phone or something like this, and we might see and actually we already have our mobile ultrasound devices, which is empowered by the AI, can in a very effective way impact the pregnancy issue and diagnose the pregnancy issues, at least the main ones, and it can save a lot of this is already there. This is already there on the market and all of this stuff. So I think, it's a very tough question, but I think, the conclusion is healthcare accessibility. It will be a way easier than ever, and healthcare also will be democratized as we didn't see before.
Great.
Julia, can I add a little bit to that? From a technology perspective, of course, since we are talking about diagnostics and investigative methods, there are a few more aspects of the healthcare also that will be touched by the AI. Of course, nobody has seen the future, as you rightly said, but we can at least predict some of the things that will come in the near future, looking at the way AI is advancing. So one of the things that is being talked about is generative AI, how it will help improve the training of the models that are used for diagnostics or predictive healthcare. That is part one. Second is from the patient perspective, there are AI assistants that are coming in for better counseling or better monitoring of their health. There are also AI models that are coming for personalized medicine using genomic data. And from the doctor's perspective, there's AI in the operating room, which can help them keep the procedures in a standardized way, or rather monitor the procedures in a standardized way, train the students better. And also, lastly, there is AI which is coming for ensuring better delivery of the impact. So those are some of the ways that AI is evolving.
Sounds like that's feeding into what Amr was saying about the democratization piece.
Absolutely.
But there's, a lot of pieces. And I know, Camila, you talked about machine learning advancements. This is constantly technology that's evolving in real time. So appreciate that additional insight there. Camila, did you want to jump in quickly? Yes, please.
Very enthusiastic. Even if probably the pace of technological advancement will exceed our expectations. I agree with both of you, but I'll just include on something I mentioned about this fragmented healthcare system. And I think and wish that somehow technology and AI will help us evolve into a robust health data interoperability, where health systems can talk, where we can access data in an ethical way, and make really efficient healthcare systems, reducing costs, increasing time, the delivery of the results, the approach of patients, considering all factors. I think that is a great challenge worldwide still. And I hope that this data interoperability field will evolve and develop.
Sure. No offense to you, Amr. I'm going to end with a focus on women's health and close out with our other two speakers. So I'll start with Camila and then end with you, Veena. So as our final question here, Camila, first to you, October is Breast Cancer Awareness Month. We're at the end of the month, but still very front of mind for many people. So close out for us here with your thoughts on really women's health and how AI can help women monitor their health, especially for that cancer detection we talked about. What's sort of the message you would leave as we address, breast cancer among other cancers that affect women? And of course, there's men that are affected. I don't want to discount that, but sort of given it's Breast Cancer Awareness Month, wanted to end on this note. What would be your message to women who are benefiting from these technologies?
Great, thank you very much. I think that AI can definitely play a transformative role in helping women monitor and manage their health. By integrating AI throughout the whole healthcare journey, we can create a comprehensive or holistic approach that not only addresses even breast cancer pathology, but also enhances overall well-being for women and even patients everywhere. The application of AI contributes at, I think, every stage of the patient journey, as it can increase efficiency, access, and overall outcomes. For example, during early detection throughout imaging, both for pre-screening and screening methods, we can use AI to make this process, as mentioned previously, more efficient. The risk assessment, AI can assess individual risk factors by analyzing personal health data, family history, and even lifestyle choices. For the symptom tracking and reporting, AI-powered mobile apps that today exist can help women track symptoms and changes in their breast, for example, over time. This leads us to personal treatment plans, where, as I said, and how we use our patient navigations, we can analyze extensive data sets to assist oncologists in the development, the definition of personalized treatment plans, promoting, in the end, better healthcare outcomes related to the profile of the women. Remote monitoring and navigation. Yeah, as I said, virtual assistants helping them, the patients navigate from the emotional point of view, from the socioeconomic point of view, obviously on the healthcare point of view too. And also regarding research and development. Today, as we know, drug development is really expensive. It takes a lot of costs that are then translated into the access of different and innovative treatments. So I think that that AI can contribute to accelerate the breast cancer research, analyzing clinical trial data, identifying patterns, and suggesting in a data-based definition new avenues for investigation.
It's Breast Cancer Awareness Month in October, but AI seems like it's enhancing that awareness in and of itself. It's playing a key role in this effort. Just to close out, Veena, I'll give you the final word. I know you're working on cervical cancers. I'm sure there's other solutions that'll stem from that. But just closing out on the focus with the focus on women's health, what would be your final word here?
That's a very critical question, Julia, because world over there are about 1 billion women who require regular health tests, just because cervical cancer and breast cancer are two of the biggest killers around the world. And unfortunately, most women are not aware that regular testing or early detection can really help save their lives. So if AI can make preventive healthcare accessible to all the women from all the social strata by making such tests available in their local clinics, that will be, I think, a fantastic transformation that we should all look forward to. AI will, of course, help in reducing the cost of diagnostics, so that women will start prioritizing their own health, because we have seen this in so many countries, that women always give priority to their family's health, their children's health, or their husband's health. But when it comes to their own health issues, they always think, I'll go to the doctor next when I get time. And oftentimes women who are from the lower, social strata also have to think about their daily wages if they have to just go to a city hospital. So they avoid, doing all these additional travel or additional expenses on their own healthcare. So if AI and, even advances in telehealth and remote monitoring can help in bringing that healthcare into their daily lives and make sure that the delivery of the care is given to them in a less expensive manner, in a more integrated way with their lifestyle, then I think that will be a big change that we'll be bringing about. So I think AI has a great role to play in future for everybody, but especially for women, I think it will be a great game changer.
And you mentioned the stakes are high. The statistic you shared with me earlier, it's 3,000 women. What was that number?
For cervical cancer, 300,000 women die every year because their cervical cancer was not detected early. 50% mortality rate is there. If you think about a decade, it's almost 3 million women who are dying due to cervical cancer. So if that kind of an impact can be reached, if those lives could be saved by bringing in a small intervention with the use of AI, what more do we want?
Everything you've all outlined is super inspiring, and wow, you're making an impact in such a real way. All of you, Amr, Camila, Veena, thank you so much for your work every day. Thank you so much for speaking with me today. Really appreciate your valuable insights. Thank you to the audience for tuning in. If you want to watch the entire session, it will be posted on the Zayed Sustainability Prize's YouTube channel. It's really an honor to get to speak with you all. Thank you so much for everything that you do.
Thank you, Julia.
It was amazing.
Yeah.
Talking to you all.
Yeah, same here, Camila. Thank you, Amr. It was a pleasure talking to you. All right.
The pleasure was mine. Yeah, thank you so much.